busy schedules, and I appreciate you taking time out of your day to listen to my spiel. What we're going to talk about today is a survey that was actually sent out a couple of years ago to paramedic program directors. And it was looking specifically at safety-related risk factors in the educational environment for paramedic programs. You see here the authors of this particular study. These are all folks that at the time were on the research committee for the National Association of EMS Educators. At that time, I was the chair of that committee, and the other folks here were also on that committee. So I just wanted to let you know that this project was originally sponsored by NAEMSE. They both supported the project and provided some financial support for some of the data analysis that is actually still ongoing. I am an immediate past board member of the board of director for NAEMSE, but I am no longer. Not that that's necessarily a conflict, but I was a board of director when we did this study, and it was sponsored by NAEMSE. Otherwise, there really isn't any major conflicts. I do want to kind of start off with another disclaimer, though, that this study that we did, this survey, there was no intention to find anything wrong with what any specific program was doing, or to point out something that we thought was being done erroneously or intentionally or anything like that. So it was really just a snapshot of kind of what was going on at that specific time in the field of EMS education. We started the survey with just paramedic programs because they were kind of easier to disseminate the survey to. We could kind of control the data that was coming in a little better. But this in no way is meant to just reflect paramedic programs. It's really kind of a snapshot for everybody that works in EMS education. I also wanted to just point out, and I'll mention this again towards the end, that keep in mind that the data that we're going to look at is actually pre-COVID. So we know that in this area, a lot has changed since COVID. So I think it's important that we kind of bring light to this topic because of what's going on with COVID, but we also, kind of can appreciate that some of this might have changed just in the last couple of years, and you'll see kind of some of the topics and questions that we asked. So, so this is really just for awareness. It's really not to highlight what we thought was a problem within EMS education or anything like that. So how did this start, or where did this idea come from? Well, you all probably know what this picture is of. I was actually on a walk one evening when I got a call from one of my EMT instructors, and he said, "You're not going to believe what happened." He was actually demonstrating the use of an EpiPen to a new EMT class, and he stuck himself with a real EpiPen that someone had donated, and we had no idea that it just got thrown in the box with all of the simulated equipment. So when we went back and looked at kind of what we did wrong and where we could improve on that, one of the things we noticed is how identical the training device, which is on top there, looks like the real thing, which was on the bottom. And to some extent, we intentionally do that because our motto, especially in our program, is train like you fight. So we want our meds to look like real meds. We want the colors to be the same. We want the devices to be the same, and we go through a lot of painstaking effort to make sure that happens. But the downside of that is that you potentially open yourself up to some liability. So that's kind of what got us thinking about are there a lot of opportunities for these things to happen within the educational environment? And then as we kind of inquired a little bit further, it turns out that this happens quite frequently. A lot of colleagues had shared similar experiences, specifically with EpiPens, but with some other things as well. So that's kind of how the idea grew is, let's take a snapshot of kind of practices, current practices within EMS education, and let's see, again, not to point out anything specifically, but let's see if there even really is a problem. And if there is, like, how can we address those particular areas? Study from Reichert in 2017, where he did some phone interviews of EMS personnel that were coming into the ED. And we know that we have a higher propensity for injuries in our line of work. What he found was that 40% of those coming into the ED that were EMS personnel were sprains and strains. 90% of those were related to lifting, carrying, or transferring patients or equipment. 20% were exposures, kind of like what happened with my instructor. There were 14% were contusions and abrasions, 10% were punctures and lacerations, 5% were fractures, and 10% was other. So we know at the very least that we're much more likely to experience injury in our field. But I think that sometimes we feel like this is an unavoidable consequence or just the nature of our work. So it's almost like there's this mentality that this is naturally a dangerous job and there's really nothing we can do about it. Or, it's not a matter of if we get injured, but when we get injured. And I think we know now that we can significantly reduce or at least limit workplace injuries. But where does that start? Well, we know as educators that a lot of that culture of safety really begins in our initial training. So we really should be focusing on this, that we shouldn't be leaving this just to the employers and, to the field providers to figure out what the, right culture of safety is going to be. So do we address safety at all within EMS education? We actually do. We know that the EMS education standards are changing soon, but if you look at the current standards, there is a section on workforce safety and wellness and how that's to be addressed within education. But it doesn't give a whole lot of guidance. But yes, we are supposed to provide training, or at least provide a culture of safety and well-being, teach standard safety precautions, teach about personal protective equipment. It even addresses stress management, dealing with death and dying, prevention of work-related injuries, lifting and moving patients for sure, disease transmission, and then wellness principles. But again, it kind of leaves it up to us as to how we do that. So what does the literature right now show specifically about EMS education safety and how we train safety in our world? Nothing. There's really nothing that kind of explored this, which is another reason we thought it was pretty important to look at. So again, this study, it doesn't look at correlations or anything like that. It was more just a snapshot of what we're seeing in general, and specifically in paramedic programs. One of the things that we kind of identified, or at least hope that people appreciate, is that paramedic programs are accredited and levels below that are not. So we kind of feel like, the things that we found in this study represents probably what best case scenario is, because obviously when you have other, environments of education, that don't have the kind of oversight that we do have in paramedic programs, maybe they don't have as good of practices. I mean, I could be wrong, but it's likely that the things that we're going to present here are about as good as the environment is. Is this really important in the education environment? I mean, are we just looking for a problem where there is none? It was funny because, not funny, I guess, ironic, but when we first presented this data, the preliminary data, again, it was pre-COVID, it was the summer of 2019. This was something that I had found on Twitter like a week before I presented this initial data. And it was Kevin Callipy, who many of you may know, and he put a tweet on Twitter that talked about a paramedic student just became a statistic. So, you know, we often think about the culture of safety and the environment as providers, but we don't necessarily give as much attention to the safety of students. And, you know, right when we were presenting this, we had an incident where we had an ambulance rollover and a student was injured. And at the same time, that same summer, this happened across the pond where a student actually died from an accident of an ambulance flipping. I've kind of looked at you know, similar incidents since then. Unfortunately, I didn't find a whole lot. You know, obviously there's a lot of ambulance crashes that happen every day, but I don't believe there's been any incidents of students dying from crashes. Can't be sure of that, but anyway. So what questions specifically were we looking at with this survey? Well, one of the things that we wanted to look at was if there was a relationship between the safety risks of students in paramedic programs and the safety currently known for people that were out in the field. Like, was there a relationship in the sense of they were kind of being injured at the same amounts? But we also wanted to look at the safety risks in the educational environment itself. So as you will probably all know, there's different kind of components of a paramedic program and EMT for that matter as well, where they are in the classroom, they're in the lecture environment, the lab environment, the clinical environment, and the field environment. So we did look at those kind of specifically to get an idea if there was kind of any trends. The methods that we used, we created this task force from the research committee, those names that you saw on their first page. For those research geeks, this is specifically a Doman tailored design. We did pilot the survey and did a debriefing before we sent it out to all the paramedic programs. The survey was quite long, and we appreciated that, you know, that was probably going to affect the responses, but we did pretty good for such a long survey. 120 questions. It was sent through Qualtrics. It was deemed exempt through IRB, through my university, Weber State University, and there were 692 programs, accredited programs, or those with a letter review that we sent this out to. We did get the support of COA. They actually provided us the contact information for the accredited programs at that time. This is the outline that we looked at. We kind of broke the survey down into different background or different categories, and then we just really brainstormed on what should fit into those categories. So we looked at the student backgrounds, preparation and orientation to paramedic programs. We looked at variables of the equipment, the skills that they were performing, personal protection. And then we also looked at program demographics. And then we asked about like what is actually happening in these different environments, in the classroom versus the clinical versus the field, just to kind of, again, go back and look at that percentage of incidents versus what we're seeing in the actual workforce. So we sent 692 out. We had 47% of those that actually started their survey. Unfortunately, not everybody finishes surveys, but we did have 41% finish the survey. When you have statistics that you can relate back to your starting number and actually have that percentage, I mean, that's a little bit more sound than if you just send it out randomly to an unknown number of people. 40% is not horrible. Unfortunately, for a lot of the publications that are probably most common in our field, they get so many submissions that 40%, is a little bit lower than what they like to accept the publication. So we actually weren't able to get this published just yet, but we are looking at a couple other avenues to get this information out there. But certainly doesn't mean we can't present venues like this. So just some of the demographics that came in from these survey respondents. We kind of wanted to look at if the people responding on the survey were similar to, just what we see overall in the paramedic education population. So we found that it was pretty well spread out, and most of them were public education programs. A few of them were private. Most of those private were not-profit. So this breaks down the actual percentage of those. As far as the types of programs, what degrees or certifications they offer, 31% offered certificates, 62% offered associate's degrees, 6% bachelor's, and not many master's degree programs. We also broke it down into FEMA regions, and there was no specific reason that we use FEMA regions other than we had used FEMA regions in previous studies to kind of see, where in the country the responses were coming from. And the problem with doing something like states is there's some states that only have one paramedic program. So if you saw a response from that state, then you would know that that came from that program. And we really wanted this to be de-identified data because, again, we're not trying to point any fingers, like, suggesting that anybody is doing anything wrong. Okay, so we're going to get now into the responses and some of the questions that we asked. And this isn't all inclusive. These are just things that we thought were kind of most important or really showed some interesting feedback. So one of the things we looked at was, do these programs do drug screening? And you can see that most of them do, and most of them actually do urine drug screening. Some of them do blood, hair, saliva, and some of them weren't really sure. They did blood drug screening and they didn't know what the method was, or they just weren't sure if they did it. So I suppose there are some program directors, and again, this was sent directly to the program directors. There are some program directors that have, some coordinator, or this stuff is done outside, so they know it's done, but it's not necessarily something that they handle. We also looked at some other admission requirements. So do they do a criminal record check? And you can see a fair amount do. Hardly any were doing mental health screenings. Most were doing drug screenings and immunizations. You can see that the majority were not doing N95 or HEPA fit testing, which we suspect has changed significantly over the last year or so. We also looked at whether they were doing a specific safety orientation in these different areas of education. So in the skill lab, clinical, field internship. And you can see that a lot of them were, but it wasn't equal by any means. And we didn't include lecture in there because we didn't feel that most of us are doing any sort of safety orientation for a mere lecture. And then we also looked at maximum hours allowed. Do these programs require a maximum hour of duration that they're allowed to work in clinical, field internship, or outside employment? So for instance, if somebody was working a 48-hour shift, would they be able to come in and do a clinical rotation immediately after that, or a field internship? Or would they be able to do a rotation through a field internship and then go do their regular shift. And you can see how that breaks down. Some of them did have requirements, but most of them did not. And we also ask if they are allowed to do overnight shifts during clinicals or field internship. That was a little closer to equal. And we asked if students were allowed to sleep during field internship. And you can see that most of them actually said yes, that they were allowed to sleep. Some of them were not. And these were just of the ones that were, that did have an overnight shift as an option. We asked programs if they use stretchers in the classroom. Not that using stretchers in and of itself is a safety concern, but there are some things that come along with using a stretcher that could potentially be a problem. You see that 98% of them do use stretchers in the classroom. And only about 78% of those that did use stretchers allowed students to be, or live individuals to be placed on the stretchers. And then we looked at preventative maintenance of the stretchers. And our thought was that most agencies probably do preventative maintenance on the stretchers, but did we find that also important in the educational environment? And you can see here, well, let me back up a bit, that only around 80 of them do it annually. About 30 or a little bit more do biannually. And there was 65 programs that weren't even sure if maintenance were done on their stretchers. And then just about as many as what do it annually never do it at all. And then some of them reported some other type of time frame, and it might have just been as needed, or maybe they do it every 3 years. We also looked at programs that actually have a drivable ambulance, and had about 110 that actually do have a drivable ambulance in their program. So again, there's an opportunity for some concern. So we looked specifically at some of the variables of the drivable ambulance. For instance, are students allowed to be in the back while the ambulance is driven by an instructor? And you can see that just over 80 said that they were. So then we looked at was there any training for the person driving that ambulance? And of those that actually had drivable ambulances with students in the back, we only had about 69% that said that they had to undergo training. And again, are these good numbers? Are they bad numbers? We're not suggesting one way or another. Again, it's just a snapshot. It's for just to put the information out there and everybody to kind of see maybe where their program lies in the scheme of things. And then again, just to look for opportunities if there's an area that we really should be focusing on. Are seatbelts required by students when they're in the back of the ambulance? And you can see that 43% said yes, and 43% said no of those that were in the back of the ambulance. Are students allowed to drive the ambulance? And only 34%, 35% said that they were. The rest were not. And then those that the students drove the ambulance, did the students have to go through training to drive the ambulance? And 80% of those said yes, they were. Okay, and this is kind of a big topic. There has been some incidents that we'll talk about of simulated medications or real medications in the educational environment being stolen or disappearing. So we looked specifically at medications used in the classroom, and we asked programs if they were using donated real medications, purchased real medications, or if they were using simulated medications. And you can see how that breaks down here. About 150 were using real medications, 150 of the programs that responded. were using real medications that were donated. And this breaks down the numbers. So most of them, fortunately, are using simulated medications, but it was interesting to see that this many programs were still using real medications. This is a website that we'll refer to a little bit later, but there was a report of a simulation center director where they had caught a group of students on video actually taking medication vials that were simulated medications, but they were real vials. And apparently they thought that the medications were real, so they were stealing them. Fortunately, they were confronted and it was addressed before they were able to do any harm. But you know, it goes back to, is there potential for issues with using real medications, or even medications that are labeled as real, even if they're simulated? And yes, apparently there is. So we looked specifically at, are these meds stored in a secure location when they're not in use? And you can see that most of the programs said that they were. We also look at oxygen tanks. Again, we really just brainstormed as to what had the potential of causing safety concerns. So oxygen tanks was one of those things. Are we using real pressurized oxygen tanks? And about 80% of the programs said that they were using oxygen tanks. So then we looked at, of those using those pressurized tanks, how many of them are actually testing those tanks? And this is the breakdown. So 5% of the program said they never tested the tanks, which I think is a pretty good number overall. And 15% of them weren't even sure if they were tested. And you can see there were some that did annually, biannually, upon expiration. And I think some of those that were not sure, it was probably they were using a vendor, so that it's very likely they were being tested, but they were done by the vendor, so they didn't know how often they were being tested. We also looked at specific skills that we thought had a potential that were performed on other students or volunteers. And you can see that 71% of programs actually perform IVs on students or volunteers. 30% both IM injections sub-Q. Not many doing IOs on real people. Some are doing NG tubes. Most are doing glucose testing, and some are even putting in nasal airways. We either didn't ask about OPAs, or there weren't a significant number of those, which is understandable. So, but we looked at CPAP as well, and then anything that they deemed to be other invasive skills. So we asked the question, can students opt out of volunteering, or are they forced to have these skills performed on them? For instance, in our program, we do IVs on each other, but because, you know, we know some people have clotting disorders and things like that, they do have the ability to opt out of that. And you can see that 62% said that their students could opt out of it. 30% said that they could, but only under certain circumstances, for instance, if they have a bleeding disorder. And then 6% said no, they can't. Then we asked, are students required to show competency on a skilled trainer before they can do it on a live person? So intravenous access, for instance, 98%, which is a great number. Yes, they actually have to perform the skill on a simulated mannequin or some other device before they can do it on a real person, which I would think is appropriate. For IM injections, same thing, 92% have to perform it on a mannequin. And those few that did IOs on a live person, 100% of those had to perform it on a simulated device first. Subcutaneous injections, 92%. And G tubes, 83% had to perform on a simulated device. And glucose testing, interestingly, about half of them did, half of them did not. So I think you can see that kind of relates to their invasiveness and maybe to their potential for causing problems. I don't think many of us would consider a glucose stick to be problematic in most cases. And then here was the nasal airway respondents. 93% of those did have to perform it on a mannequin for a live person. CPAP, almost 80%. We also asked about mental health services available to students. You can see that 92% said that they did have mental health services available to students. We also asked the question as to who is performing those mental health services, and that was just a whole array. Some of them said that it was the program themselves, like the program director. Some of them were outside sources. Some of them were school counselors. So it was just kind of all over the place. There was no specific trend there. Got into gloves and PPE. How often are students required to wear gloves during simulated vascular access in class or lab? 80% said always. 8% most of the time. And a few even said never. Again, so is that wrong? Is that right? We don't know. We're just kind of putting it out there and allowing everyone to determine maybe where they stand in these. How often are students required to wear air or face protection during airway access? And again, we feel like this is probably one of those areas that has changed significantly in the last year, but only 50% said always. And again, 11% said never. Are students permitted to perform lifting and loading during their internship, specifically their internship? And 55% said yes, that they were. And you see 30% said that some agencies will allow them while others do not. Also looked at seatbelts. Are students required to wear seatbelts during their field internship? And 45% said yes, they were. 25% said they're encouraged but not required. And again, some agencies do, some of them don't, so they weren't sure how that broke down. We asked about ballistics vests, and not surprisingly, most do not require or don't have access to ballistics vests. 61% do not, 27%. Some of their agencies do, some do not. And then of those that do have ballistics vests available to them, are they required to wear them during calls? And 25% said no. And 36% only on select calls. And some of them, as to be expected, would say that they were not allowed to go on those calls where a ballistics vest would be needed. We also asked about high visibility vests on roadway scenes. And fortunately, most programs are requiring their students to wear high visibility vests. And this is how it breaks down. Again, a lot of them, you know, as would be expected, use various agencies for their field internships. So Okay, so then we also, as I said, we looked at the incidents that were actually occurring in the educational environment. And we just looked over the last 2 years. We asked how many of the following student-related incidents have occurred in the skill labs in which the student required evaluation or treatment at an urgent care or an ED. And 3% reported that there was one incident that was required of musculoskeletal injuries. Soft tissue injuries were 7%, and then exposures, for instance, a needle stick, were 6%. And as you can see, as the incidence goes up, the percentage goes down, which is as expected. So again, is that an alarming number? I don't know that that was our intention to determine if it was or not. It was more just to put it out there and let all of us as a community kind of determine where we need to address. The past 2 years, how many of the following student-related incidents have occurred in the clinical setting, so specifically in the hospital, where they required evaluation? This is how that breaks down. So there were a couple, but once you get to 3 or 4 incidents, there were absolutely none of those that responded. Seems that most of the incidents relate to needle sticks, which again is not surprising. And then the past 2 years, how many student-related injuries were related to motor vehicle collisions? And we did have a few. So what this means is that we had 15 programs say that they did have one incident. Past 2 years, how many student-related injuries were related to lifting and moving? 18 programs reported one incident. Past 2 years, how many student-related injuries were related to violence? And 12 programs reported an incident. Again, this is given the current environment, we often wonder if this is another area that has changed significantly in the last couple of years. You look at the stories in the news around airline incidents, and kind of think that relates as well to healthcare providers. The past 2 years, how many student-related injuries required an overnight hospital stay as a result of an injury or exposure? And there was only one program that reported a hospital stay, and they said that there were actually 3 different incidents where that was required. So I don't know if that's an outlier or not, but fortunately there wasn't a whole lot of hospital stays required. We also looked at how many students actually lost time at work or school as a result of an injury or exposure, and we only had 3 that reported an incident, and we had 4 that reported 2. Okay. And then the big question, of course, is how many students have died as a result of a program-related injury or infectious exposure. And we're very happy to report that nobody, at least during this survey, had died from an incident related to education specifically. So, okay, so absolutely there were some limitations. This was self-reported data, and obviously when you're putting somebody on the spot like this, it's very likely that there were some things that people maybe didn't want to report, even though this was reported to be de-identified. There was no way for us to kind of tie back these responses to any particular program we weren't looking to provide any, any punitive, to any of the programs, or really point any fingers or anything. A lot of variations in programs. So obviously that I think will contribute, because you've got some programs that are hospital-based, fire-based, in which, their educational environment may kind of overlap with their work environment. Again, very narrow snapshot. Even the questions that we asked on injuries and exposures were just the last couple of years. So there certainly can be waves, just like there are with anything else. And we don't know if we were, kind of taking a picture of a downward wave or an upward wave. And again, the big one for a lot of these questions is that these were answered pre-COVID, actually just prior to COVID. So we suspect that a lot of these would be different now. So what's next? Not exactly sure. There is some opportunity for us to do some correlation with the different numbers that we got. For instance, do we see more incidents within hospital-based programs versus fire-based programs versus university-based programs? Not sure that there's a lot of value in doing that, but there is the potential for that. And then there's obviously some areas that maybe looked a little more concerning that we could kind of pursue a little bit further. But I think, again, more importantly, it was just information that we wanted to get out for the program, so you could kind of look at maybe where your program stood in relation to, the average, I guess. We do know that there is some significant work being done on safety within EMS itself. Bigham and Patterson specifically are doing some work on safety management systems. There was even a more recent study that was published on the culture of safety. And we do know that there is some effort going on to provide safety within the educational environment itself. So some of this does kind of seep into accreditation requirements. We do know that there's some requirements to label medications, for instance, not for human use, even if it is simulated medications. And then from that website, Healthcare Simulation Safety, there's even the 10 Commandments of Healthcare Simulation Safety that you can find this. This has become kind of quite common. Some of the references that we used, the things we just presented. And if you have, certainly take some questions now, but if you have any other questions or want to provide any other feedback, here's my contact information. I'm happy to share the PowerPoint. We have submitted the study to another peer-reviewed journal that we're hoping will publish this soon. But anybody have any? I don't see any questions in the chat. Rio, do you see anything?
No, I don't see any. Looks like some compliments.
Well, again, the most important thing is it certainly wasn't any intention to suggest that somebody is doing something wrong. I think it was more just to identify if there were areas that we can do things better. So I hope that nobody took it that way. So we there were certainly things that we asked where I had to look at current practices with our program and just thought, man, we've really been missing the ball. thanks for the comments. And again, if a question comes up later, certainly always available to respond to that. Well, thank you, Rio. Thanks to NAEMSE and Stephen in particular for supporting this study. As I said, they were very supportive of doing this and thought it was a very important topic to kind of pursue.
Yeah, of course. And thank you so much for presenting, and thank you everyone for joining in. If you didn't already see, I submitted the link to register for the CEU in the chat, but if you miss it here, there's no worries. You'll get it in your follow-up email tomorrow. And I'll be sure to include your contact information in the follow-up email as well. And then this will be posted on YouTube today, so that will also be in the email tomorrow.
Great.
So I think that's everything.
All right.
Thank you, everybody. Have a great day.
Have a great day. Be safe.